Well, good afternoon. My name is Ron Aaron Eisenberg, and I have the honor and really pleasure of being your host today for the Global Pain Association's Virtual Education Series. We've been doing these programs once a week now for several months, and these run a half hour. We bring you a topic of interest to people who may be struggling with a variety of different sources of pain. Global Pain Association is really in business to try to help those who are in the millions deal with pain that begins in the morning and doesn't end till they go to bed at night, and even then doesn't end. The Virtual Pain Education Series is brought to you by that nonprofit organization, the Global Pain Association, and we have a very special topic today, health and wellness for chronic pain. Kimberly Beasley, health and wellness specialist with ACOG, the Area Agency on Aging, is our guest today, and I want to remind you that thank you to the Alamo Area Council of Governments. They are our sponsor for today's program. They have collaborated with Texas Health and Human Services Commission to address opioid misuse among adults 60 years and older. Free doTERRA drug deactivation kits are available to dispose of expired prescription opioid medications. Proper disposal safeguards older adults as well as the environment. Additionally, they have magnets available identifying the types of opioids along with a local phone number for substance abuse resources. If you're interested in obtaining the kit, magnet, or other AAA services, simply call 210-477-3275 or toll free 866-231-4922. At the beginning of each of our programs, we're delighted to welcome Dr. Susan Blackwood. Dr. Blackwood is the founding force behind the Global Pain Association. Once COVID-19 hit and we couldn't hold broad, large public meetings, she came up with the concept of holding these virtual conferences, and they've been going like gangbusters. Dr. Blackwood, good to see you.
Good to see you again, Ron, and thank you so much for being our moderator and the Eisenberg Group for producing these incredible series. We've got over 30,000 followers now, and Global Pain Association Board of Directors has voted to keep the series going this fall. We'll be doing these bi-monthly, and we've got a ton of good topics coming up as we create the third part of the series.
Now, you did one live seminar several months ago, had tremendous turnout, so you knew the interest was there.
In September of 2019, and the registration filled up immediately. We had planned to double it in May, and when COVID hit and we knew that we had to make alternative plans, this was a blessing in disguise for us.
And for the Global Pain Association, you and I will talk in a little bit about how folks can get involved, how they can contribute, and how they can support your work. And in the meantime, we're going to put you behind the scene so you can take some notes on our presentation today. And I want to introduce our very, very special guest who is with the Alamo Area Council of Governments, ACOG, and has spent a lot of time working on the kind of issues that we're talking about. Her name is Kimberly Beasley, and her email address will be right there under her name. By the way, she's got a great smile. Health and wellness specialist with the Alamo Area Council of Governments, the Area Agency on Aging. She teaches evidence-based health and wellness classes to seniors 60 years old and older to help them make healthy lifestyle changes. The focus is on nutrition, low-impact exercise to build strength, flexibility, endurance, and balance. Kimberly graduated from Texas A&M San Antonio with a bachelor's degree in kinesiology and exercise science in 2017. And Kimberly, it's great to see you. Thanks for joining us. Give us the 411 on what ACOG is all about.
Thank you for having me today. I really appreciate it. So ACOG is dedicated to building a community that supports older residents and allows them to age in a place with dignity and have enhanced quality of life. So we do a range of services, and a couple of them are our congregate meals and home delivered meals to homebound seniors. We have benefit counselors who can help with Medicare and public benefits and our ombudsmen are advocates of long-term communities, nursing homes, and assisted living. We have our Alamo Regional Transit, which is ART, and they'll provide transportation to appointments, community centers, or to the grocery store. We have our care coordination who offer short-term in-home services, and our caregiver support access. They assess the needs of our caregivers, and then they coordinate some available support services that they may have. And then we also have our health and wellness programs, and those are free. And we offer physical fitness classes and prevention programs.
And one of the things I want to talk with you about today, and we know that our viewers are interested in, we live in a world where chronic pain is simply so prevalent for people who wake up with pain, spend the day in pain, go to sleep with pain, and you offer through the Alamo Area Council of Governments and the AAA programs that deal with this, exercise programs, as you mentioned, no cost. But how often do I have to do this?
How often do you have to do the classes?
Yes.
Well, so let me start by saying that we use evidence-based programs. And all that means is that our programs have been studied and they've been proven to classes are enhance independence and quality of life, and it's going to increase mobility and encourage socialization. So there's 3 classes. They're A Matter of Balance, Texercise Select, and Bingo Size. And all of these programs, they have exercise components, and they deal with 4 types of exercises: balance, endurance, flexibility, and strength. Have people who are suffering with chronic pain for a while, it can start to affect their mood and their health. And so doing just a little bit of exercise a few times a day can boost their production of those feel-good endorphins, and it can reduce the chronic pain. The classes are not very long. Our Matter of Balance is 8 sessions, and we meet twice a week for 2 hours. Our Texercise class is 10 sessions, and we meet for an hour and a half. Size class is sessions as well, and we meet for an hour.
And for those of us who want to participate in these programs, how do we sign up? Do we have to be a resident of the 13 counties, Bay Area and the surrounding counties, or can anybody join?
You have to live in San Antonio, yes, and the surrounding counties, the 13 counties. You can go to our website at www.acog.com, or you can call that toll-free number, 866-231-4922, or the 210-477-3275, and they can provide information for you. And you can also send me an email with the email address there at the bottom.
kbeasley@acog.com. So Kimberly, I'm one of those people who, when I want to get involved in something, I figure you got to buy the equipment. So I've been out looking at a variety of pieces of equipment, from treadmills to climbing equipment to bicycles to weights. What do I need to participate in your program, the ACOG Health and Wellness Program?
You just need your body. You actually don't need, equipment isn't required. You can use, because we do hand stuff, shoulder movements, so you don't need equipment. But if you would like equipment, you could use cans or water bottles. You don't have to go out to buy anything special. Very simple classes to do.
So cans will give you the weight, right?
Yes.
And the water bottles as well.
Exactly.
Now, I'm assuming because of COVID-19, these programs are now virtual through Zoom or some other resource.
That's correct. We're using, our platform is GoToMeeting, and they are virtual. And like I said, you could just shoot me an email if you're interested in some classes. We have a couple of classes that will be starting next month. And excuse me. And all you have to do is go to our website and you can find that information.
For me to sign up, I've got such a busy schedule. I do so much. How do you take that step to say, all right, this is important, I'm going to do this, carving out that time?
So it actually doesn't take any time. So even as you're sitting here talking to me, you can start doing exercises. Simple stuff like rolling your shoulders. Because what you're trying to do is get that blood circulating into those areas that may be inflamed, like your shoulders and your joints. We do hand exercises like this, rotating your ankles, turning your neck. This is all stuff that you can do while you're watching TV. In between the commercials, just stand up and start standing on your toes or marching. It's very simple.
Somebody said to me that the worst thing for our health was the invention of the TV remote. In the old days, you got up and changed the channel. Now,
Right.
you get your kid to get the remote, and then you change the channel.
That's so true. And that's why when you're sitting there waiting for your son to bring you the remote, you can do the hand exercises that I just showed you, and you'll get that blood circulating.
Now, if I want to get involved in the exercise program, I know part of this involves healthy eating as well. Now, that plate doesn't look like the plate I remember from elementary school. Protein used to be 3/4 of the plate, I think.
Correct, correct. So this is the new Choose My Plate. It took the place of the My Pyramid. And of course, there's more vegetables, some fruit, some healthy grains, and small protein, like 3 ounces. And then you also have your dairy. But choosing good meals is really important for that chronic inflammation. And as we all know, that chronic inflammation can lead to arthritis and heart disease. So finding a natural way to ease that pain is a good way to do it by making healthy choices. So in our class, we talk about limiting those processed foods like cookies, chips, and fast food because they're high in trans fats and salts and sugars that aggravate that inflammation. But also in this class, the Texercise class, we focus on stress management, injury prevention, ways to keep exercise fun and eliminate those barriers that keep you from being active.
When you talk about stress management, especially in light of COVID-19, so many people are concerned. We see people get sick. We see some people we know who are dying. The stress is enormous. How does ACOG help us with that?
So by providing these programs that, and our caregivers provide programs for individuals who are maybe at home taking care of a loved one with Alzheimer's to give them respite. So we have programs like that. The Meals on Wheels is a wonderful program that alleviate that stress of having to worry about getting food. And transportation, the ART program helps with that because if you're worried, well, how am I going to drive to my appointments? All these programs help ease that stress.
Now, as you think about getting these programs going, do we have to schedule for me to take a course? Can I take it at any time because they're being done through a virtual system, or do I have to be at the class when the class is held?
You have to be at the class when the class is held. You don't have to attend all the sessions because a lot of them, like my Texercise has 20. So you may have other things that you're doing and you may not be able to attend, but we do encourage you to try to attend most of the classes if you can.
I was thinking that maybe they're in a library somewhere and I can pull them up. And I know if I want more information, here's where I go, acog.com or 210-477-3275. You can write those numbers down, take a look at them, and figure out whether those are the places you want to get the information. Now, Kimberly, as we have covered most of what you've been involved in at the AAA, is there anything we haven't covered that you want to throw in?
Excuse me. Just that our classes are very interactive and you have a lot of fun. And so with chronic pain, I know that you feel down and depressed. And in our classes, we get to talk, especially in our bingo class. You get to play a game of bingo. Who doesn't love bingo? But then you get to exercise and you get to meet new people. Doing that social interaction is always important, especially during this time.
Now, do you find, even though it's all virtual, that folks are making connections with others in the class?
Yes, so it's wonderful actually that it's virtual because then people in New Braunfels will meet somebody in Fredericksburg that they've never known before. And I sign on to the classes early so that they have time to talk and interact with each other. So it's very nice.
Well, that's pretty cool. Well, I want to thank you for spending time with us again, Kimberly Beasley with ACOG and the Alamo Area Council of Governments, AAA. You can find her at Kate Beasley at acog.com. Thanks so much for joining us.
Thank you for having me.
Really, really appreciated the information. And I want to thank folks too at ACOG who were the sponsors for today's program, from the Alamo Area Council of Governments, the Area Agency on Aging, the AAA. They collaborated with Texas Health and Human Service Agencies on aging and more to address opioid misuse among adults 60 years and older. Free doTERRA drug deactivation kits are available to dispose of expired prescription opioid medication. Proper disposal safeguards older adults as well as the environment. Additionally, magnets are available, and you can identify the types of opioids along with a local phone number for substance abuse resources. If you're interested in obtaining the kit, the magnet, or other AAA services, just call those phone numbers that are scrolling across your screen, 210-477-3275, or toll free, 866-231-4922. Let's bring Susan Blackwood back to our program. Susan, as many of you know, has been responsible for the virtual education series. Dr. Blackwood is Executive Director, Head of the Global Pain Association. It's good to see you. I hope you got a little bit of information out of Kimberly's presentation.
That was so interesting, Ron. And, I really appreciate Diane Rath and the people at ACOG, because they have these programs that are free to people living in 13 counties. And people just don't know about the programs. So things that Kimberly was saying today and people going to their website is extremely important. And certainly people with chronic pain need more and more of these resources that are free, accessible, just like Global Pain Association is. They can go to our website, and there are many, many articles and lots of information that will help people with chronic pain manage their pain with alternative methods. And their caregivers will learn so much from that as well. We are not only appreciative of all of our sponsors, but these relationships with these organizations are critical to the success of our program. And if people want to get involved with Global Pain Association, they can get our website. We have a tab that says Get Involved. They can volunteer. They can get our newsletter, or they can even make a donation. And no donation is too small. We need all the help we can get to make these series possible.
Now, I've asked you before how you got involved in the whole issue of global pain, and you mentioned that for years your mother had been abusing opioids. You had no idea.
Well, no, she was addicted, that's for sure. And I went to Omaha once a month, but I was living in San Antonio, and I was pretty much in denial. And then when my father passed away, she wasn't getting that much care from the caregiver. I think the statute of limitations is up, but I kidnapped my mother and brought her to San Antonio. And that's how I met the pain doctors here and got interested in starting an organization like this a few years ago.
When did you realize she was abusing drugs?
It was her quality of life and her depression, that sort of thing. And I think, I didn't really go to appointments with her, but it was obvious that she really depended on these medications. And it was hard, very hard.
And through the Global Pain Association now, folks who are concerned about situations involving loved ones, they can get the kind of help that they need, a direction into resources that are out there in our community that most of us aren't aware of.
It's all free, Ron, and we've got a great group of volunteers that are on our board and our advisory council, and I certainly feel like it's a great team trying to do a lot of great work.
And again, for folks who want to contribute, how do they do that?
They go to our website, globalpain.org, and there's a button that says Get Involved, and there's lots of things that they can do, but we would appreciate any donations that we could get. It's a way to help a lot of people that need a lot of assistance in San Antonio.
Anything you want to add?
Well, again, I want to thank the Eisenberg Group and you, Ron, for doing this week after week. Now that we have 30,000 followers, I hope people that are watching today or that go to our website or to our Facebook later on this week or later on today, that they'll share this information because it's on there forever. And that's why we're so grateful this series has been so popular.
And we've had a lot of nice comments thanking Kimberly for coming on today. We appreciate all of you who are watching this. I want to let you know, and Susan, thank you very much. We appreciate the work that you've done for the Global Pain Association. Coming up next week, right here on the Global Pain Association's Facebook page, this is a very special program And I don't know how many of you are aware that white males, Anglo males, 65 years of age and older, are the leading group for suicide in this country. A leading group as well for alcohol abuse. Well, it turns out that suicide, depression go together and are often connected to chronic pain. We're going to talk about it next week. What you should know, how to understand what suicide is all about, how to intervene, how to look for the signs, and how if you are thinking of taking your life, there's help out there for you and where you can go to get that help. We'll be joined next week by Dr. Melissa Deuter, and the topic is so critical, so important. Tell a neighbor, tell a friend, join us for the Global Pain Association's virtual pain series. On behalf of the Global Pain Association, I'm Ron Aaron Eisenberg. Thank you so much for joining us, and we will catch you next week right here on the Facebook page for the Global Pain Association. Thanks, everybody.